We realized early on that there were relatively few Black people involved in the policy issues that had to do with harm reduction, and that they were not well represented in terms of running harm reduction programs, and that the Black people who had a hand in building the harm reduction movement in this country had been erased from history.
There's been a lot of erasure and flattening of the context of harm reduction and what communities of color and specifically Black communities have done in that context. I think oftentimes it has been perceived as something that was given to Black communities, and yet Black communities have always been doing some version of harm reduction since we were stolen from the land and then brought to the U.S. And enslaved. There's always been strategies of how to reduce the harms associated with being Black in America.
Harm reduction is about mutual aid and getting out of the way and centering people who use drugs and sex workers, to lifting the veil of stigma that surrounds most substance use and the othering of people who use drugs.
Harm reduction does not demand that a person stops using drugs in order to get connected to care.
Harm reduction is supporting us in addressing the ills of slavery and settler colonialism and the ways that it impacts Black people.
This is a form of my own need for Black harm reduction, is to be in spaces with people who are having the conversation that I want to have.
So I think when we talk about harm reduction, we need to make sure we stay focused on the harms that are created by us, by our policies, by the laws, not by the people who use drugs.
But the messaging behind harm reduction is your life is valued. We want you to stay alive. We will do whatever we need to do to help you avoid death. Harm reduction as a strategy and as an ethos is fundamentally about loving people.
Although addressing the current overdose rates in Black communities is one of the issues that connects us together, we recognize that our partners don't have the luxury of focusing on a single issue. Therefore, our goal, the goal of the Black Harm Reduction Network, is to build out a network comprised of partners that are working on connecting issues, not just in their city or state, but across the U.S. Moreover, we are working to ensure that the issues they are working on become part of the conversations that are taking place on the national level, and that the solutions they have created inform federal policy. We achieve these goals in partnership and through coalitions with Black-led organizations and individuals who are providing harm reduction services to Black communities and BIPOC communities. Additionally, we offer tailored support and technical assistance to organizations who want to advance their advocacy and their services they offer.
Our purpose is to provide an opportunity for Black advocates, communities, and organizations to give direct input into defining and working on issues that are causing harm to Black communities and working toward wellness for those communities. For example, this means using public health approaches that improve the health of individuals who are using drugs by advocating and supporting syringe exchange programs and overdose prevention sites. These are really critical so that people who are currently using drugs are not overdosing and dying, and also not obtaining harmful transmittable diseases. Secondly, the network works to repairing those communities that have been harmed for decades by the war on drugs policies, laws, and approaches that directed mostly Black and brown individuals to prosecution and incarceration if they use drugs, instead of directing these communities toward substance use disorder treatment. Another example is the network works to restore opportunities for housing, employment, and access to health care. Our overall vision of success means creating well Black communities, having restored opportunities that support the state of wellness, and also having support from not only Black advocates, but from others as well.
To learn more about the Black Harm Reduction Network, please go to Legal Action Center's website.